In this lecture, we are going to discuss diphtheria. We will cover the all aspects of the diphtheria. So let's get started. First of all, you have to understand diphtheria is a disease and it is caused by bacteria, that is Corynebacterium diphtheriae. And now we have to understand the properties of this bacteria. So Corynebacterium diphtheriae is a gram-positive bacteria and it will look club-shaped in the microscopy. Basically, it is a rod shape, but at the end of the rod, there is a broad area, and that broad area will make this bacteria shape into the club. So that's why we call club shape in the microscopy. And it is non-motile, non-swarming. And the most important thing regarding the Corynebacterium diphtheriae is the toxin. Diphtheria toxin is the most important thing regarding spreading of the disease throughout the body. We call it systemic infection in the body. So we will see now pathogenesis. So how one can get this bacteria through the inhalation. So the main side of the infection of this bacteria will be throat. So you will see here is the pharynx, or you can say throat, here is the larynx, and here at the in the mouth you will see the presence of the tonsils. So first thing, it will start colonizing in the throat, and after that you will see it will produce the exotoxin. Now this exotoxin, diphtheria toxin, will inhibit the protein synthesis in the cells of the throat. You have to understand the presence of the epithelium in the throat, and in these epithelium the toxin will inhibit the protein synthesis. And after the inhibition of this protein synthesis, you will see the necrosis starts in the throat region and over the tonsils. And ultimately, you will see the formation of the pseudo membrane in the throat or over the tonsils. And after that, these exotoxin can enter into the blood, and it can affect other organs like heart and the nerves as well. So this is how this bacteria enters in the body and it causes the disease. Next, we will see about the pseudomembrane. Pseudomembrane is a thick grayish white membrane over the tonsils, over the pharynx, and over the larynx. So that is the important thing. The most important thing over the tonsils, and its composition is dead cells, fibrin, and the bacteria present in this membrane. And the most important thing regarding clinical perspective is the when the patient or anybody try to peel this layer, then you will see the bleeding start at that side. So that is the important clinical manifestations of the pseudo membrane. And transmission, as we have already discussed, respiratory droplets. If the infected person cough or sneeze in front of the normal one, then these droplets will enter into the air, and through the air it will enter into the normal person or the healthy one. So, and it can also be transmitted through the direct contact. Clinical manifestations, you will see the respiratory and cutaneous regarding the skin. In the respiratory diphtheria, you will see the sore throat. That is the important thing. You can also see the low grade fever, bull neck, swelling of the neck, dysphagia, difficulty in the swallowing, and you can also see the hoarseness, a change in the voice, and the pseudomembrane formation. So here are the different clinical manifestations of the respiratory diphtheria. You can also see the cutaneous diphtheria. In that case, you see the chronic non-healing ulcers on the skin, and grayish membrane on the skin lesion will also be seen. But the common will be the respiratory diphtheria, and you have to understand, or you have to learn all these manifestations regarding the respiratory diphtheria. And after that, what will be the different complications after the diphtheria? So basically, toxin can enter in the blood and it can affect the other organs as well. So first is the cardiac. In that case, you can see the myocarditis, arrhythmia, and heart failure. So these are the different complications. You can neurological, you can see the cranial nerve palsy, peripheral neuropathy, and the paralysis. And in the respiratory, you will see the airway obstruction due to the formation of the pseudomembrane and the swelling at that side, and ultimately due to the suffocation, the patient can face the death. Okay, in the lab, you will see the specimen will be the throat swab, and in the lab diagnosis, we will see the three most important thing: microscopy. In the microscopy, gram-positive bacilli, Albert stain will be used to check the metachromatic granules of the diphtheria. And in the culture, two most important media that will help in the growth of the Cyanobacterium diphtheria: Loeffler's media and telluride media. And in the toxin detection, you will see the Alex test. And in the treatment, you can give the antitoxin to neutralize the toxin in the blood. It can You can also go towards the antibiotics, uh, that is the penicillin and the erythromycin, to kill the bacteria. And supportive care will be the airway management like intubation and cardiac monitoring and the bed rest. So these are the different treatments that can be given to the uh, diphtheria patient. So this is all about the diphtheria. If you still have any question, you may ask in the comment section. Thank you so much.